Hi, my name is Nia, and today I will be demonstrating how to perform a CVAD dressing change. So one of the first things you'll want to do is you just want to verify the doctor's orders and gather the proper supplies before entering the patient's room. And when you enter the patient's room, you just want to provide the patient with some privacy and perform the proper hand hygiene. After performing that proper hand hygiene, what you want to do is introduce yourself to the patient and identify the patient with at least using two identifiers, which can be the first and last name and their date of birth. So now that that's done, I will gather the supplies that I brought to the room and also provide the patient a little bit of education and allow them to ask me any questions that they may have regarding the procedure. And once the patient education is done, the first step I want to do is just don my hands with some clean gloves. Sorry, a little hard to put on. There we go. All right. So once that has been initiated and you put on your gloves, what you want to do is also put on a mask. And you have your mask on, and you're going to ask the patient to turn their head away from the insertion site. And then once they've done that, you're going to provide the patient with a mask as well. And once that's done, what you're going to do is you're just going to palpate around the insertion site for any tenderness or swelling. And mind you, it's an old dressing here. You have that old gauze and that transparent tegaderm with some taping around it as well. But you're just gonna go around that site around that dressing and just make sure you don't see any abnormalities. So once you've done that, what you're gonna do is you're gonna remove that old dressing, and what I'll do is remove it, the dressing. Pulling it towards the catheter's insertion site just to reduce any further irritation or reduce the chance of pulling the tubing to cause any migration or actually pulling the tubing out. Now, once I've done that, I will visually inspect the area for any signs of abnormalities like odor, any discoloration of the skin, any discolored drainage or any drainage at all. And once that's done and I don't see any abnormalities, I remove everything from around, like the gauze and everything from around the insertion site, and I'll measure the tubing. I would compare it to the previous length of the tubing, and this will detect see if any migration has occurred with the tubing. And once that's done, I'm going to make sure I discard that old dressing and also put that into my biohazard bag, and also discard my gloves into your red biohazard bag that is either provided in a kit or inside the room. And once that's done, what I'm going to do is I'm going to perform some hand hygiene again and get my dressing change kit for the CVAD. So what I'm going to do is open this up, and I'm going to get my sterile gloves. And what I want to do is with this, of course, you're going to don your hands properly. And you're going to open the flap up. You're going to don your dominant hand first. Alright. You're going to don your dominant hand first. And you do that. Yay, got on pretty fast this time. And then alright, so we have that on. I'm gonna use this as my sterile field. So what I'm gonna do is now is once I've done that and I've made sure that my gloves are nice and snug, is I'm going to cleanse the insertion site with the alcohol swabs. These two here, and then I'll show you with the motion of this swab right here. What you want to do is when you're cleaning the insertion site, you just want to make sure to go from the cleanest area outward, so you won't introduce any new bacteria into that insertion site. You just want to clean around it, and you're going to repeat that until there are no swabs left. And you'll do this for about 30 seconds. And once you're done, you just want to allow that to dry. And you're going to put that into your biohazard bag. And you still want to make sure while you're doing this that you don't want to tug on the line any, because you don't want to cause any further irritation, and you don't want to tug on the line just to reduce you pulling it out or causing any migration. And now what I'm going to do is I'm going to activate my cleansing CHG swab, and I'm going to cleanse underneath that area. And you want to go to upward a back and forth motion for at least 30 seconds around that site. And once you're done that for about 30 seconds, what you're going to do, discard that, and you're going to allow it to dry. And once you've allowed it to dry, you're going to say you had a different CHG swab, you want to clean the line. So you're going to swab the central line from the insertion site upwards to reduce any bacteria from getting into that insertion site. And you're going to allow that to dry as well. Now, what you're going to do is you're going to apply the sterile gauze around the insertion site. And then around that tubing. And when you apply the sterile gauze, what you're going to do now is you're going to get the tegaderm, which is this little transparent taping here, nice and thin. You're going to put that over the insertion site, and when you do that, it's going to peel it back, make sure it's on there nice and snug. And now what I'm going to do is when the tubing is flapping around, make sure it's not moving or being tugged on. You just want to make sure you tape it down with some steri strips, and you can pull it in half. It's easy to tear, and you just want to tape down, a little sticky, I'm sorry, tape down the tubing to reduce it flailing around. And once you've done that, you want to make sure that you label this with time, your date, and your initials. And you're going to dispose your soil supplies that you've used for this dressing, and you're going to put all of that into your biohazard bag. And once you've done that, and once you put your things in your biohazard bag, what you want to do is you want to put your gloves in there with it as well. Now what you want to do is perform your proper hand hygiene again. Take off your mask, make sure that you take off the patient's mask before you leave the room. And now you want to make sure that the bed is set up properly with the height, properly adjust the side rails, and put the call light in reach. And now you just want to tell the patient to call if they need anything, and make sure to document everything that was done before leaving the patient's room. Thank you.